is what is an electronic health record? Okay, in short, we call it as EHR, right? So electronic health record. So an electronic health record is a digital version of patient medical record that is maintained over the time and can be shared securely across the authorized healthcare setting. So it's nothing, a service which is provided to the patient by the provider, and whatever the service he is providing, that is documented. Okay, that is documented in a sheet. Now the record is documented in the electronic format, which means you can tell it as a soft copy. It is the information is loaded or it is stored, okay, for the future processing or to send to the insurance company or to send to the patient based on the HIPAA. So that information, whatever the service is provided, whatever the diagnosis, therapy, whatever is done, that is being recorded and that is being stored in the soft copy format. Okay, so which will be very accessible to transfer from or transmit from one place to another place. Okay, that is what we call it as electronic health record. Okay, so we have few major types of electronic health record. So in common, we know this is what a healthcare record. Now, what are the types? Why we should have the types? What are the types? Why we should have the type is depending on the data size, depending on the feasibility, and depending on the availability, and depending on the share modes, the electronic health records have been modified, or we can tell like they've been structured in the format or structured in the way so that others, like depending on the insurance company or depending on the physician, they can access easier. Okay, so based on that, we do have different electronic health record, or even depending on the specialty also, because all the specialties we are not going to follow in the same format. So ED stands in different format, where radiology stands in different format, and if you see surgery stands in different format. Okay, so depending on that, sometimes where some multi-speciality we may code all together, and if you see IPDRG, where they have to take all the specialty. It is like, especially when the person is doing inpatient coding, IBDRG coding, they should have the documentation of all outpatient specialty. By seeing those specialty documentation, he has to come to a conclusion. Okay, this is what's required, and this is what the documentation, clinical documentation required to code IPDRG. Even though I'm having the outpatient documentation, as a coder, I should be able to differentiate. Even I used to tell to the people when during my training, when I give the basic training in the specialty, I used to collect all the samples, like all different set of samples. I will open it up and I will produce in front of the trainers, so that in the beginning itself, they should be able to differentiate what specialty you are learning and how the other specialties documentation will be there. So I used to take surgery example, IVR example, ambulance example, and diagnostic radiology, intervention radiology, surgery, like all the specialty, I will keep it in separate slide. I used to tell to them, see, you are a ED coder. Your documentation will be like this. And this is how the diagnostic will be there. This is how the radiology will be there. And this is how the pathology will be there. This is how the anesthesia will be there. Why? Because that is very, very mandatory. When you do the correlation study, when you do the comparison study, you will be good with what you are going to learn. Okay, so always this comparative study, associated study will give you the brighter section of your what is that, whatever you are trying to learn. Okay, so based on that, it is always better to know about the different specialties documentation. As a coder, that is one of our primary responsibility. I can tell that is a thumb rule which you need to do during your training. So the first type, okay, what we are seeing is like physician office or ambulatory electronic health record. Okay, physician office or ambulatory health record. So used in clinics, physician office, and outpatient setting. So mostly, if you see this type of documentation, electronic health record will be used in the clinics, small clinics, and directly by the physician office. They have their own offices, then outpatient setting. Key features where this documentation will have the progression note, problem listing, e-prescribing, prevention care reminder. So when you go for the primary health care, small clinics, and physician hospital, you don't want entire documentation. Whichever the bullet point required, especially whichever the points should be known to the patient, should be given to the patient. If I'm going to tell, say for example, in the ED we have this HNP, then ROS, then physical exam, then what is that? Environmental, social exam, and family history, social history. If I'm going to give all these things, how much it is going to helpful for the patient? Okay, in that situation, I don't think so. Everybody will be able to understand all these things, whatever you're providing. Chief, starting from the chief complaint till the progressive note, everything it is not going to be helpful for the patient. So only certain things. So you have this problem, this is what it is going to happen. So you have the cancer is going to be fixed or not fixed. And e-prescribing, like medicine, what is the medicine you are supposed to take? Those will be the mandatory one. And finally, preventive care reminder. So how can you keep the condition in the control? So that is what the key features which is required for the physician office and ambulatory health records. Example, family physician, specialist. Okay, specialist, when I say, yes, as I told, ED, E&M, even those informations also can be coming under that. That is what the outpatient setting. So whatever the specialties they're going to do in the outpatient setting, that is also going to come in the physician office and ambulatory. See, the interesting part here in the header itself, physician office and ambulatory. When I say ambulatory, it is not ambulance, it is ambulatory. It is for same day surgery. Okay, why? Because when you see out of this all outpatient documentation, anesthesia or radiology, ED, E&M, and what is that? Like other some specialties, we can tell, like except a surgery. Except a surgery, if you see all of the specialties, they will have some similarity, including IVR. They will have a kind of format and similarity. When it comes for the SDS, it is entirely different format. Okay, the entire format will be different because only that documentation will have the pre-diagnosis and post-diagnosis. Other specialties will not have like that. They will have directly from the beginning and diagnosis and what is the treatment. But only in the surgery report, there will be small difference. That is why the first type itself given in two names, physician office and ambulatory EHR. Okay. So this is what, like, this will provide one of the main thing why we are focusing is like long-term patient management. Yes, something it will be a continuous documentation. We have to, it is like when I go to the E&M, then from there E&M, I may be asked to go for pathology. After getting the pathology report, I may ask me to go for diagnostic. After getting the diagnostic, again, I may ask me to go for IR. From the IR or from the pathology, directly sometimes I will go for the surgery. Before providing the surgery, I need to take the anesthesia. Okay, sometimes before doing the surgery, they may ask me to prescribe the medicine. I may take the medicine. Okay, sometimes I may go for ancillary also, because what I will think, especially it happens in the primary care, primary healthcare and clinical clinics and physician hospitals, where you may go for the ancillary. Ancillary will be combination of physical therapy and pathology, or like a small radiology. All this will combine to provide the ancillary. Okay, it can be anything. So it is something like a patient who is a patient who is visiting to the hospital. It may take for a long time to close down his entire report. Close down in the sense temporarily to wind up the condition or whatever the treatment they provided. Okay, that is the main purpose of this documentation. Then next one is like hospital or inpatient electronic health record. Okay, so it is mainly used by hospitals and acute care facilities. Acute care facilities in emergency they are going, right. So like inflammation, emergency is little different from the acute care. Okay, so emergency is something I need to provide immediate attention. Okay, I need to provide immediate attention. I may come to the conclusion. The only conclusion for the emergency department is like some procedure I need to do. Okay, I need to hospitalize. I need to do the procedure. When it comes for the acute care, say for example, suddenly you got some allergy or some itching or scratch or something like that, or some burn. It is burn also. I cannot tell all type of burn because it will come for the critical care. We can tell till the third degree, fourth degree burn. Yes, they can consider for the acute care facility also. The key features for this, what is the key features? Admission and discharge and transfer. So what happens here? You will have the admission documentation, discharge documentation. Sometimes when you are not able to treat properly, you will be sent to the other hospital. That is what told as transfer, or after the discharge, you will be sent to the home through the ambulance. That is what we can tell it as a transfer. Okay, then medicine administration record. Yes, it is very, very well mandatory during the inpatient. What are the medicine they provided? What are salines or injections or morphines or painkillers? Whatever they injecting to you, that need to be tracked. That will be the key feature here. Nursing documentation, yes, nursing care. Then ordinary entry. Okay, so other entries, whatever provided, all will be available in the hospital inpatient. Okay, it is for acute care and inpatient work. Then whatever you have seen, these two things, okay, one is like physician office, the other one is like hospital. I can tell it is based on the setting, inpatient setting and outpatient setting. So this is one set of criteria. Okay, two set we can tell in the outpatient, like in the hospital setting, as well as in the outpatient setting. So we have two different electronic health records. Then comes enterprises health record. Why we have the enterprises health record means, like it, the hospitals, okay, the hospitals in United States works in the network manner. We can call it as PMO network. Okay, like that, different type of set of networks are available where from the beginning, see, in our country, I will consult one doctor. For imaging, I will go to one laboratory. So I will go to one center, and for pathology, I will go for one laboratory, or one center. Laboratory, I will go for one center. For collecting the medicine, I will go for the what is that, medical shop. See, we do have different places, but in that, especially in the United States, they do it in the network. So patient, once you enter into the gate, you cannot go outside of the gate. You don't want to go outside of the gate. Everything is available in my network itself. In that basis only, they used to tell that is that enterprises health record. So what here happens is like these entire records are maintained in a single system. Okay, yesterday we were also discussing a combined systems, like encoding softwares we have seen, right? So that is what I'm talking about. And now they're developing, especially these two ventures. One is Epic and one is Cerner. Cerner is a very big Oracle software company. He is developing. He is developing. Even I was telling you yesterday, I don't want to tell their name. That person Cerner, he is developing a super system where entire healthcare system in future, if you're going to get job in Cerner and all, it's going to be very nice. Super company it is. So they're trying to bring even the billing, AR, everything into one platform. So the future of the coding, everybody is thinking it is AI. It's not true. The future of coding is the coder, either he should be knowing the billing or he should be knowing the AR, or it should be combined with the denied. So future it is like, if you are good with these three verticals, billing verticals, coding vertical, as well as AR vertical, if you're good with that, how the entire workflow happens in that RCM, what are the steps being taken from the pre-registration to till the clearing house, if you're able to understand everything, then you will be having the such a importance and you will be having the such a demand. Okay, so what is the market prediction is telling, like people who are aware of these three verticals, a coder, see the possibilities of the building an AI person, it is very, very difficult. He can to learn the coding, but the possibility of the coder to learn AR and billing is very, very easy. Like 20 to 30% of difficulty will be there. Remaining 70 to 60% where you can 70 to 80% you can learn easily. And the predicted salary for the future, like maybe after 5 years, if you are good with these three verticals, your minimum salary will be 1.5 lakhs. Why I'm telling it is 1.5 lakhs means it is going to incorporate with the automation also. So to run the entire automation, all three verticals, to overcome all the data trafficking, if you're good with all this content, what is coding, even in the coding, if you're good with the multi-speciality, see previously like before 2 to 3 years, if you're good with one specialty, you are a hero. See, any sector, if you go, you will not have the multi-talented person. More than the multi-talented person, you will have the single-talented person who earns a lot. If you go for any IT industry, if you go for any developing industry, if you go for manufacturing and R&D, everywhere you should be knowing only one specialty or any one technique or any one skill, so that you can grow very big. But now, especially when it comes for the healthcare sector, in that RCM, especially in RCM, now it has become previously, if you know only radiology, you are good. So you can become a team lead for radiology, you become AD for it. Now it is not like that. You should know the multi-speciality. When you know the multi-speciality, you can approach all specialties of these verticals. Okay, now the future is going to be like this. ED billing, ED AR, ED denials, ED coding. At least that vertical. If you're not multi-specialty also, multi-vertical you should be aware of. Then as I told you, future will be very good. In the same time, when you enter into the industry, it is going to be very nice. And as I told you, salary, minimum salary, it will be like 1.5 lakhs to 2 lakhs. That is what the market is telling now. That is what statically data science is proven that how the healthcare, especially US healthcare, is working. And upcoming, even Canadian healthcare is entering, Australian healthcare is entering. Maybe after 10 years, even India, our country will involve in the medical coding also. There is a chances. 1 decade we have to wait. Like our future people, like our kids or somebody, they can enter. Why? Because our government is working on bringing the healthcare sector completely under the insurance, so that everybody will be get benefited. Just imagine 40 million people in the US for the medical insurance, and we are getting 2% of the Indian population is working in the medical coding sector, which means like RCM sector. Just imagine 160 crore of people in India. If everybody is going to come under the health insurance, just go for just 100 crore. Everybody is going to come under the health insurance means, then see the job opportunity. See the picture, how big it is. Okay, that is how it is growing. Okay, so this enterprises CHR. So what happens here? Basically, it is a large health system integrated delivery networks. Okay, so it is like one place you start, everywhere your people only. It is entirely your enterprises only. You can any specialty you can shift the documentation, any specialty you can provide the access, where it combines the inpatient and outpatient also, single patient record across all the facilities. Just imagine, that's a very huge task. One report, all the facilities, specialties, facilities, for all the settings it has to use means that is something like unimaginable thing. Okay, so as I told, continue care, like what is the benefit in this means? So the patient will be focused. You can track what is the status of the patient in each specialty, and what is the final status of the patient. If this all works, these electronic records are kept in one enterprises level. Okay, that is what I'm talking about. Just give me a minute. Okay, so that is a key benefit. Okay, key benefit on the combines the inpatient and outpatient, and it provides a single patient record across the facilities and shared clinical and billing modules. These all are the key features for the enterprises EHR. So next we'll be seeing into the one more type of EHR, that is specialty specific. Okay, now this is very unique one. As I told, all the facilities or all the hospitals are not going to have all the specialties. Certain hospitals, even though it is a network hospital, they handle only one specialty. They will not do all other specialties. They will handle only one specialties. So those kind of practices, those kind of EHR records, we call it as specialty specific EHR, where example radiology, oncology, behavioral health, like that. Key features, specialty templates will be there. Disease specific workflow will be there. Okay, yes, as I told, if you go for gastrointestinal, there again in the gastrointestinal you have the hepatology, pancreas separately, gallbladder separately, and you have the colon related separately. Okay, so like that you will have the disease specific flowchart will be there, customized documentation. So you can customize the documentation. It focuses on the specialized clinical needs. Then next one is like patient portal and personal health record. Okay, here what is the main thing is like it will be owned by the patient. So now in the day-to-day life we see, if I wanted to tell one good example in our current situation, there are big multi-specialty hospitals, especially I'm located in the Bangalore. In the Bangalore I used to see there are so much multi-specialties hospitals, which can tell corporate hospital also, like a Tricare, Fortis. Okay, so this kind of hospital, Jain Hospital, what they're doing is like they are providing the access to the patient. They're providing application, or they're providing a link to access by the patient to check what is their status directly. They can able to review their visits, lab visit, and scheduled appointments. Okay, and download a record and send it to the second opinion. Okay, and that will be in a secure format. Okay, that is what the key features in that other countries also, in our countries also, that is what is the key features where you can be able to access. Even if you see previously when I do a blood test, okay, I need to wait for at least 24 hours. So in the beginning of the era, like 10 decades before, we have to wait for 2 days at least to know what is a complete blood test, blood count. Now you go and give the blood. Next 10 minutes, you are receiving the message, especially these Newbergs, Anand Labs and Newbergs Labs. What they're doing is like they get your mobile number, they will collect your sample. You will be just out of the lab only. Immediately, you will receive a message saying that this is your blood count report. That is how the facility has been developed. Okay, so those kind of reports, those kind of PHR record, like PHR record, we call it as not EHR, PHR records. Those are like personal health record where patient able to access. It will be completely in the patient control and not the provider control. Okay, that is what the key feature, key difference. What is the key feature difference for EHR and PHR means? PHR, provider will not have the access. EHR, patient will not have the access. When I say patient will not have the access, it is not like complete access they cannot be able to provide. Only few things they will be able to provide. Then cloud based. Okay, now it has become very famous. Everywhere you are working cloud based electronic reports only. Okay, so everything has become automated. Previously, if you remember, I'm not sure, like since you are lesser experienced, I'm not sure like how it works for you. So like when we were working, if there is no download today, like say for example the Saturday Sunday, they for them Monday will be like Sunday. In India it is Monday, means for them it will be Sunday. What happens? There won't be download because we work till Saturdays and we'll clear it off. Everything will be cleared. Our Sunday will be their Saturday. They don't work on their Saturday. Our Monday will be their Sunday. Sunday midnight. So what happens? Previously, it is like turn on system only. They have to come back to the facility or come back to the hospital, and they have to release the documentations whichever they kept for the coding. Okay, now it has become different where directly the reports are getting uploaded before going to the home. The physicians or physician assistants, okay, the people who are responsible for that, they're uploading the reports in the cloud server. It is always available. Okay, so it is a communication. There is a common folder which is kept for like client as well as for the customer, where both will be able to access the cloud and they'll be able to do the coding. Okay, so that is we call it as cloud-based EHR. The key features: internet access, then automated updates will be there. Lower upfront cost. Yes, it is not like something I need to store in one folder, and from my folder I need to send a copy to your folder, so that I need to maintain your folder also some amount and my folder also some amount. So to avoid that, they kept it in the cloud so that you can access by providing the credentials. Okay, advantage scalable, which you can measure how many is going to come, when it is going to come, what time we can complete it. All these things we can able to do. That is a scalable and easy remote access. As I said, you can access very easily. The next one is like on-premise EHR. On-premise EHR means servers which is maintained by the organizations. Okay, as I told. So something like they will send it from that place, that will be received to your server. It will be stored in your server. Then you will process and work it. Then you will send it back. Okay, so what is the key features here? You will get a full control. The organization will get a full control, and you can custom configure. So you can custom configure means you can segregate or you can categorize with the modality wise or specialty wise, and you can do the coding. You can set up your team. So you will take it like a multi-specialty project and you will hire the people for multi-specialty. But everybody cannot do the multi-specialty. I will segregate internally in my own server and I will ask the people to code. Then while sending back, I will combine and send it back. Okay, that is what called on-premises EHR. Disadvantage: high maintenance cost, required IT infrastructure. That is a disadvantage. So far, we did not see any disadvantage. This is the only disadvantage we are seeing in the on-premises EHR. Now it has been completely getting reduced because everybody is working on the cloud-based one. Then interoperable or HIE enable EHR. So we'll be seeing HIE also, nothing health information, nothing that also we'll be seeing separately. That will be our next topic. Okay. So health information exchange. Okay, here purpose. The main purpose here is like support a data exchange with the other system, use HL7 and FHIR standards, focus on seamless information sharing across the providers. Okay, that we'll discuss then. So something it is like this information like you can exchange. This is also a type of EHR. That is what they're trying to tell. Okay, a type of EHR where you can exchange between the other systems by using the internal or external servers. Okay, seamless information sharing across the provider. Okay, we'll see something like related to the exam. Key difference at a glance. Okay, here if you see ambulatory EHR, it's outpatient ownership provider. Inpatient, it is hospital care. It will be owned by the facilities. Then enterprises, it will be like a system-wide care. Organization will have the control. Specialty HR, focused care, provider will have the access. PHR, patient access, patient will have the access. Cloud EHR, remote access, vendor and hosted, both will have the access. On-premises EHR, local control, where organization will have the ownership. Okay, so here if you see, patient will have only PHR, where provided two people, specialties and ambulatory, both are outpatient setting, I can tell. Okay, and organization two, one is the enterprises and on premises will be from the organization. Okay, just put it logical way so that you can be able to understand. Okay, so two provider, two organization, one patient, and one facility and one vendor. Okay, so just if you put in that way, you can be able to understand. Then what is EHR and what is EMR? EHR, digital record within one practice, where yes, EMR, digital record within one practice, where EHR shareable across multiple settings. There is a small difference. Okay, so the electronic health record, where you can send it to the different people and they can able to access and they can able to process, where EMR only one, like you can download. So I can tell like manual record, nothing else. EHR means electronically manual record. Some of the documentations where you have to do it in the manual, we have to do the manual coding in the on the PDF itself we used to code. Okay, that is what digital record within one practice. Okay, so we'll get it and we code it and we'll send it back. Okay, that is a major difference between the EHR and EMR, electronic manual record. Okay, this is on the EHR. Okay, so I'll go for the next topic.